Today, we're here to talk about measles. It's been in the news. What do you need to know? Hi, I'm Dr. Sue Tansky, a primary care pediatrician here at Dartmouth Health Children's and the section chief and vice chair of pediatrics. What are the measles? The measles are an infectious disease caused by a virus. It starts off with a high fever, a cough, runny nose, and red eyes. That lasts for about 2 to 4 days, and then you have a head-to-toe rash that's red and bumpy, and you don't feel very good. Why do we worry so much about the measles? Well, it's one of the most infectious diseases that we know. About 9 out of every 10 people who are susceptible to the disease will get it if they come in contact with someone else with measles. Measles can be a really serious disease as well. About 1 out of every 5 kids who get measles will end up hospitalized with some sort of complication. That can be dehydration because they don't feel well enough to drink. It can be a secondary pneumonia. It can even be meningitis. In 2000, the World Health Organization declared that measles was eliminated from the United States. What that means is it's not completely gone, but that means there have been no new cases within a certain period of time and that there's no pockets where it's actively circulating. Fast forward to today in 2024, and this year we've already had 13 outbreaks so far. In the entirety of 2023, we only had 4. That represents a very significant uptick in the number of cases and potential exposure. The most important thing that parents can do to protect their children from measles is make sure their kids are vaccinated. We vaccinate first between 12 and 15 months of age, and we do that second dose between the ages of 4 and 5. And making sure your kid is all the way up to date is the most important thing. Measles vaccinations are very, very safe. We give them at 12 to 15 months. We give a second dose at age 4 to 5. They're really well tolerated. And 93% protection with 1 dose and 97% protection with 2 doses. A lot of parents are wondering what they can do to protect their babies against measles because we don't typically vaccinate until the age of 12 months. Fortunately, maternal antibody can protect your child for the first 6 months or so. Then it starts to wane, so between the ages of 6 and 12 months, we start worry about a little bit of increasing susceptibility. If your child who's under the age of 12 months has a known exposure to measles, we do post-exposure prophylaxis. And what that means is your baby will get injections to prevent them from getting sick from measles. In the first several days of a measles infection, people don't yet know they're sick. So they might be out and about in the community. They might just have a cough, runny nose, which is typical of so many other things. It's hard to know something is measles until you have that rash, which happens about 4 days in and you've already been contagious. So it's really important to have a high index of suspicion if you have any symptoms about a respiratory disease and if measles has been in your community. If you have any question about whether or not you're up to date with your vaccinations, call your doctor. What happens if someone gets measles who has been vaccinated? Between 3 and 7% of people who are vaccinated could still get measles if they've been exposed. They have a much milder disease, however, and they are less infectious to other people. So again, vaccination is protection. Thanks so much for all of your questions. It's really important that our community be aware of measles, how contagious it is, and how to protect yourself. And as we've talked about, vaccination is protection. So make sure that you and your loved ones are protected with measles vaccination.